Hi, this is Dr. Sykes, and in this vlog I'd like to talk about healing after a Caesarean section delivery. Now there's a lot of information on my website about Caesarean sections. There's a lot of information about what will happen when you're having a Caesarean section. It's very detailed, so please check that out, and also a lot of information about my surgical technique and so forth. I'll start by saying I'm a very neat person, very tidy, and that lends itself to my suturing after a Caesarean section. I suture every layer very, very carefully. I start by suturing the uterus. There's 3 layers of stitch there. The first layer is the inner part of the uterine muscle. I avoid the what's called the sigil or the endometrium, because if I catch that in the stitches, a woman is more prone to a condition called placenta accreta in the next pregnancy. In other words, the placenta gets into the actual muscle, which is a huge problem. I have done well over quite a few thousand Caesarean sections, and I've never had an accreta yet. So I'm comfortable my technique works, because statistics are I should have had quite a few accretas by now. So the first layer, then the second layer is the outer part of the muscle. The third layer is the skin, the peritoneum, over the top of the uterus. Now a lot of my colleagues don't bother with that layer. I think it's very important, so I stitch that together carefully. Next we move on to the abdominal wall. I suture the what's called the parietal, or the peritoneum, parietal peritoneum carefully. Again, a lot of my colleagues don't bother with that, and that leaves a woman prone to adhesions. And I've had the scenario where the fat around the bowel, indeed even the bowel, is stuck solidly to the anterior abdominal wall, because the previous obstetrician was slack, just couldn't be bothered suturing all the layers. That means that woman would have had a worse recovery and likely to have ongoing pain. Indeed, when I open a woman up who's had an operation with a previous doctor and I find these adhesions, I take them all down, I suture her carefully, and it's not unusual for her to comment, "I feel so much better now. The discomfort that she had for years after her first delivery are now gone." Now, so I suture the parietal peritoneum. I then put 2 interrupted figure of 8 stitches to bring the muscle of the abdominal wall back together. I mean, every woman wants a flat tummy, and this helps to facilitate then. I then do a continuous suture to the sheath layer, and then I suture the fat in 1 or 2 layers, and then I suture the skin in a subcutaneous continuous stitch, so there's nothing to come out, and it heals up extremely well. And then we put a dressing, a special dressing called Comfield dressing, over the top of that. Now what that means, that fussiness, what it means for the woman is that her recovery tends to be extremely good, and women will go home with minimal, quite often no analgesia at all, because they have an excellent recovery. A classic case was a woman where I did a hysterectomy on her, because of uterus that came up, fibroid uterus came up to deliver with a belly button, or umbilicus. She didn't tell me, but 2 weeks after the operation, she drove to Queensland and back. Why? She felt better. She didn't have any pain at all. So there doesn't have to be a protracted, long, difficult recovery after a Caesarean section that I do. So the discomfort will settle down usually quite quickly. Certainly I can give women analgesia to take home, and I usually do. But certainly there doesn't have to be a difficult recovery, which is a woman's big fear after a Caesarean section. Will I have a long, difficult recovery, lots of pain? The answer is no, usually not. Sometimes yes, but usually that's not the case. So don't be too frightened about having a Caesarean section. Bye for now.